Hello guys, welcome to my YouTube channel. My name is Raymond, and in today's video we are going to look at how to write a nursing care plan for the patient who's complaining of pain. So before we begin our presentation, please do make sure that you subscribe to this channel, you share, and you like the video. We are looking at pain. Now, you can be a nurse or a student nurse watching this video. So if you're a student, this is the right video for you, and if you're a nurse, you can also learn something from this video. So when you look at pain, of course, there are different types of nursing care plan problems. We have what we call as an actual problem, and we also have a potential problem. So an actual problem, this is the primary problem that the patient is experiencing. While a potential problem, this is the problem that has not yet occurred, but it can occur when we don't look after the patient nicely, or when we don't prevent the patient from having a secondary problem. So that is what we call as a potential problem. Now, pain on its own, it can come as an actual problem and a potential problem. So I'm going to show you guys how to write pain as an actual problem, and I'll also show you how to write pain as a potential problem. Now, please remember that if you are new to the nursing care plan, there are different types of nursing care plan, of course, column. And in this video, we're going to use this type of column. So we have a column where you write the problem. So in this column, this is where you're going to write your nursing care plan problem, which you have already seen is pain in this video. And the second column, this is where you write your nursing diagnosis. Now, what is your nursing diagnosis? A nursing diagnosis, this is where you're going to explain how this problem is coming in about. In here, you explain how the patient is experiencing this problem. That's where you're going to write in the nursing diagnosis. And aim or goal, now in this column, this is where you're going to write, of course, what you are trying to achieve. The patient is complaining of this problem, or you have noticed that the patient has this problem. So what are you trying to achieve at the end of your nursing intervention? So this is where you're going to write your aim or goal. Now remember, when you are writing your aim or goal, it has to be SMART. Now if you remember, S, it means that your aim or goal has to be specific. M, it means that it has to be measurable. A, it has to be accurate. And of course, R, it has to be realistic. And T, it needs to have a time. And that's the reason why you have seen we have written that is 30 minutes. Now, I will explain further in this video why there is 30 minutes. And this fourth column, this is where we're going to write your nursing intervention. What things are you going to, of course, implement? What things are you going to do for this patient so that they stop experiencing this problem? This is where you're going to write your nursing intervention. Now, when you write a nursing intervention, you also have to write a rationale. You need to explain to the examiner the reason why you're doing that intervention. Otherwise, if you write a nursing intervention without the rationale, the examiner will not mark you. Then the last column, this is where you're going to write your evaluation. All right? So your evaluation has also to be SMART, just like your aim or goal. Has the patient stopped experiencing these symptoms? Has the patient stopped complaining of this problem? Okay, so now we are looking at pain. Okay, so now let's look at pain. So again, please, if you are new to this channel, do make sure that you subscribe. You also like and share this video. So we're looking at pain. In an exam, as a student, you can't write pain as a problem. Why? Because there are different types of pain. Remember, the patient, or in an exam, the patient will be complaining maybe of leg pain or abdominal pain. So you have to be specific in an exam. Is it abdominal pain? Is it leg pain? So you can't write pain as a problem because the examiner will not mark you because you are being general. Is it a general pain, general body pains? Is it leg pain? Is it abdominal pain? So please be specific. So we write pain here as a problem. Then we come to the nursing diagnosis. So remember, this is just a general video. So nursing diagnosis here, I've said you explain how this pain is coming in about. And you also give a reason, that explains why or how you have seen that this patient is complaining of this problem. So we say pain related to, you begin to explain. If you want, you can say pain due to, whichever one you prefer. You can say related to or due to. So pain related to irritation of the nerves by toxins, evidenced by John verbalizing. Now remember, where is this name John coming from? So we have used the name of John as a reference. Why? Because when you are writing an exam, you need to write the name of the patient that you have been given in the scenario. So if the name of the patient is Mark, you need to write Mark here. If the name of the patient is, let's say Eunice, you write Eunice here. If it's Isabel, you write Isabel here. Okay, so in this situation, this video, we are using the name of, the patient. So we say pain related to, you begin to explain. Irritation of the nerves by toxins, evidenced by John verbalizing. So this patient by the name of John has told you to say, I'm having pain. Then you know that the patient has pain. We come to the aim or goal. Now, remember I said it has to be smart. So what it means when we say it has to be smart, you need to begin with the name of the patient, because that simply means that you are being patient-centered. You need to begin with the name of the patient. So we begin with the name of the patient, that is John will be relieved, okay? John will be relieved from pain after 30 minutes, okay? After 30 minutes of nursing intervention. So we want John to be relieved from pain after 30 minutes of nursing intervention. So when you look at this, we are being specific, okay? We are being smart. We are looking at this as a patient-centered. Why? Because we have begun with the name of the patient, and of course we have explained our aim in a smart way. Will be relieved from pain. Then the time frame comes in after 30 minutes. If you want, you can say before 1 hour, okay? Before 1 hour of nursing intervention. So we go to the nursing intervention. So what intervention are you going to do? Number one, it's very important. This is very important. When you're a student, some students, they write, I have, in the nursing intervention. Please, when you're a student, you don't have to write, I have. You write, I have, when you are working, of course, when you are working, you have already done that nursing intervention. Then you say, I have, because you've already done it. But when you are writing in an exam, you say, I will, because you are telling the examiner what you are going to do. So you say, I will assess John pain score using universal pain assessment. In order, remember, where is the rationale coming in? This is the black, as you see, the black ink explains the rationale. So why are you assessing John pain score? So I will assess John pain score using what? Universal pain assessment. Why are we doing that? In order to determine which analgesic will be effective. Now remember, the patient can have a pain score of 5, and another patient will have a pain score of 8. So those are the different threshold of pain. So you need to know which analgesic will be effective. You can give paracetamol, the patient has got a pain score of 10, and paracetamol won't have any effect on them. So the reason why you are assessing the pain score, you want to know which type of analgesic to give. So you come to the second bullet, you say, I will switch on, of course, the television set to allow John watch his favorite program in order to divert his mind from pain. Now, diversional therapy is really very important, okay, to the patient. So here we have used, of course, the TV. We have used the television set. Of course, depending with the scenario, other resident or other patient, they'll fancy, of course, having a chat, listening to music. So you need to explore. When you're working as a nurse, of course, on the ward, you need to explore what the patient loves or prefers. So if the patient loves to listen to music, you can turn on the music. If the patient loves to watch the program, of course, you turn on the program, their favorite program. And by doing so, you are diverting the patient's mind from the pain. And that is what we call non-pharmacological management of pain. So I will switch on the television to allow John watch his favorite program in order to divert his mind from pain. So you notice how I've written these rationale. They are not the same. They are actually different. I'm not just simply saying to relieve the patient from pain. And this is what you need to be doing in an exam. The rationales, they should not be the same, because each nursing intervention has got its own rationale. So we come to the third one. I will reposition John to his preferred position to promote comfortability. Hence, so this has to be in black ink, hence reducing pain. Now, repositioning, of course, posture is one of the cause for pain. When you are standing or sitting in a position which you are not comfortable, you'll be complaining of pain. Okay? So once you try to reposition the patient, you see that they'll tell you to say, this is my comfortable position. I think for now I'm fine. No, I don't need analgesic. Because of the repositioning. So it's really important that you check their preferred position, or maybe you check where they're sitting on. It can be they're sitting on something which is hard and is causing pain. So you try to reposition the patient to the, of course, comfortable position, and by doing so, you are reducing pain. Now we come to the other, of course, nursing intervention. I will administer prescribed analgesic. All right? I will administer prescribed analgesic. Now, I don't just want to say I will administer analgesic, because I, as a nurse, do not prescribe these medications. These medications, they're prescribed by the GP. So you say, I will administer prescribed analgesic such as paracetamol to relieve John from pain. Okay? You give analgesic. Now, you need to give an example of analgesic. Which type of analgesic are you giving? So that is paracetamol to relieve John from pain. Then the other one, you say, I will refer John to pain management team for further control of pain. Now, this is very important, guys. You need, of course, to refer John to pain management team for further control of pain. Now, of course, when you're a nurse, you work with different departments. And in your department, there's what you call as the pain control team. So when you refer John to pain management team, they will know how to deal with his pain. Okay, so these are your nursing intervention and rationale. So we go to the evaluation, which is very simple. So evaluation. In the evaluation, you simply explain to tell the examiner to say, my outcome is this. You are explaining your outcome in the evaluation. All right? So you say, John has been relieved from pain after 30 minutes of nursing intervention. You are telling the examiner to say, I've done all these nursing intervention and John has been relieved from pain after, which is after, where is it? After 30 minutes of nursing intervention. So we are being specific, and we are also being patient-centered. We begin with the name of the patient and the name of the patient. We are not looking for someone else. We are actually looking for the pain of John. And this is John. This is being patient-centered. Now, after 30 minutes of nursing intervention, How do we know that this pain has been relieved? So we say, evidenced by John verbalizing of no pain. So John is going to say, I'm no longer in pain. Then you know to say your aim has been achieved. So this is how you write a nursing care plan for any patient who's complaining of pain. Now remember, just a summary, you cannot write just pain on its own as a problem. You need to be specific, please. You can simply say leg pain or abdominal pain, depending with the condition that the patient has in your question, in an exam. Then, when you come here, you explain how pain is coming in about, or how that problem which you have identified is coming in about. And please remember to be more specific when you are writing the aim or goal. Now, the key point is that when you see we say will be, here we say has been. Here you say will be, here you write has been. These are the key points. Then you write everything and you write everything. Then you just add the evidence. So where do you get the evidence? So you see here, where do you get the evidence? So in the nursing diagnosis, this patient told us to say they are in pain. So you get the evidence from here. So you see evidenced by John verbalizing. Well, in the evaluation, we say evidenced by John verbalizing of no pain. So that is how you write a nursing care plan, guys. And thank you so much for watching this video. Please do make sure that you subscribe to this channel, you like as well as you share this video. Thank you.